Hello, I'm Dr. Marty Martin at DePaul University, and I'd like to welcome you to the series on quantitative decision-making tools, or if this is the first time that you've seen this particular element, if you will, then welcome. So the focus right now is going to be on incidence and prevalence. Yep, and these are terms with regard to epidemiology, and I'll define what that is in a moment. But it's very important in healthcare to have some understanding and be able to actually calculate incidence and prevalence. So let's talk about a definition of epidemiology. So in essence, epidemiology really is just the study and the distribution of diseases and illnesses. Not only is it important to really understand what incidence and prevalence is, because all those are tools that fit within epidemiology, but also to define what epidemiology is. So let's take a look at a formal definition. It's the study of the distribution and determinants, or think causal factors, of health-related states in specified populations. So it could be a city, could be a county, could be a country, could be an organization. And the application of this study of what? The distribution and determinants of disease to control the health of populations. So not control from a control freak point of view, but to really reduce unnecessary morbidity, sickness, and mortality, death. So that really is what epidemiology is. Epidemiology is an applied science, and that applied science goes beyond simple understanding to also prevent and help people actually treat illnesses, diseases, and disabilities. So let's look at some definitions of epidemiology. So one is it's a quantitative basic science because it draws heavily on probability, statistics, and sound research methods. It's also a method of reasoning, so causal reasoning. Because remember, one of the hallmarks of epidemiology is not only to understand and describe, as well as not only to analyze, but use that analysis to inform prevention and treatment and intervention methodologies. So fundamentally it's what? It's a tool for health action. So let's distinguish between epidemiology and what clinicians do. So if you'll note, as a clinician you diagnose a patient. You investigate, you get labs, you get x-rays, you make a diagnosis. Then you provide a treatment plan or a therapeutic plan based upon the diagnosis. Some cases it might be management. Yep, certain high blood pressure is manage that condition. Depression largely is manage that condition, whereas in other cases it may be a cure. Think about the common cold. For an epidemiologist, very similar thinking process, but they're the diagnostician for the community. Remember, it's population-based. They do investigations, they collect data, they predict trends, but fundamentally, say for example, there's an outbreak of some gastrointestinal bug. So not only do they want to predict the trend, but control the trend by prevention. So there is something that's called the epidemiologic approach. So I've highlighted the major tasks in each one of these boxes. There's the descriptive piece, simply describing the outbreak. Imagine this, you get on a cruise ship, all is well. Maybe it's your honeymoon, 25th anniversary, whatever it might be, just a good time. So you get on the cruise ship and you notice that everybody who ate the crab salad and the Waldorf salad, they are vomiting and they have diarrhea and abdominal cramping. So you want to describe that, yep. So who ate what, where, when, so that's description. The analysis is what caused it. Yep, so you may not know what caused it, so then you have to go back and say, well, everybody ate the Waldorf salad between 6 and 7, they got the cramping and the diarrhea and the symptoms. So that's where the descriptive and the analytic go hand in hand. Then you want to take a look at your measures. So you can measure by time, rates and ratios. Then you have to think about your methods. So you may design a study, you may conduct a survey, then you'll analyze that data, and then more fundamentally you will interpret that data. But interpret that data for action, because remember, one of the definitions of epidemiology is a tool for action. Then you look for explanations. So in a lot of cases where you're looking at causal reasoning, you're thinking it might be the salad, but it may not be. And then you have to make inferences, which are really kind of informed judgments, but fundamentally take action at a number of levels. The behavioral level, clinical level, so that way the clinicians on the ship can diagnose this by asking the question. On a community level, really making sure the kitchen did their job and pulling that from the line, if you will, as well as pulling that from the cafeteria, if you will. And then environmental. So that's the epidemiologic approach. So now let's distinguish prevalence from incidence. So prevalence really is the number of existing cases. So if we go back to the cruise ship, how many people have these GI symptoms? Is it 10? Is it 20? Is it 100? Incidence is the number of new cases. So how many people new who previously did not show symptoms are beginning to get symptoms? So that's prevalence versus incidence. So let's use this as an example. So in 2012, 75 out of 400 patients acquired an HAI, hospital-acquired infection. Of the 75 who acquired the HAI, 25 were readmitted for treatment for the HAI. Of the 25 that were readmitted, 10 died in the hospital. Questions. What's the HAI prevalence rate for 2012? So let's take a look at that. So we have to go back and we say, okay, how many patients have HAI? So 75 out of 400 acquired HAI. So now we know 75. Yep. And then say, well, the prevalence rate. So 25 were readmitted. We're not looking at that. 10 died. We're not looking at that. So the prevalence rate is 75 divided by 400. That's your prevalence rate. Now let's go to the readmission rate. So of the 75, that were those that acquired the HAI, 25 were readmitted for treatment. Okay. So among all patients, we don't have data for that, but the readmission rate would be 25 readmitted out of the 75 that had the HAI, or 1/3. So this is the analysis stage. After the analysis stage, it's what's the so what? So what are you going to do about it? What do you want to control here? First thing you want to control is to get the HAI's prevalence down to 0 by first stemming all new cases, the incidence, and then making sure that everybody that acquired it, that they're in a good shape physically because you want to prevent deaths. So please remember, when you're looking at epidemiology, incidence and prevalence as a decision-making tool, it's a decision-making tool, if used properly, can save people's lives. So this is another example, more of a population health management example. So if you note here, you have chronic conditions, hypertension, prevalence in terms of census data. So these are kind of made-up numbers. You have one physician that has a panel of 25,000 patients. You have 10 physicians responsible for 25,000 patients. Think about an ACO, Accountable Care Organization. 100 physicians responsible for 250,000 patients. And you can see how the numbers line up. So this is kind of the benchmark. So here's the challenge. Let me read it to you. You are the physician leader of a group practice with 10 physicians and 25,000 patients. So you go and you look at 10 physicians with 25,000 patients for hypertension, 4,720, diabetes, 1,450. So using the EHR, electronic health record, you discover that only 2,000 of your patients are reported to suffer from hypertension. So 4,000 minus 2,000 is 2,720. So that's the difference. So you're asking yourself, the question is, what's accounting for that difference? Is my patient population healthier on that attribute? Maybe. Are they being underdiagnosed? Maybe. So those are questions that you want to ask. You want to formulate hypotheses. Now, if you look at the 1,400 that suffer from diabetes, the standard there is 1,450. So you're off by 50. So maybe that may be random systematic error, so it's not a big of issue. As with the first one, the difference was 2,720. So you're focusing on analysis, but you're also focusing on the so what, so morbidity and mortality. So what are some factors that influence prevalence? So prevalence is increased by those factors and it's decreased by those factors. So if you have rising incidence, then prevalence is going to go up. If you have a long duration of an illness, say for example cancer versus the common cold, prevalence is going to go up. So what's important to keep in mind is that when you calculate incidence and prevalence, it's for a point in time. You want to look at it at a single point in time and over a longer duration. So let's take a look at this map. This is a famous map, yep, and it was done by John Snow. So this really looks at Geographic Information Systems, GIS, before there was actually GIS. So there were cholera outbreaks, and then John Snow had the wisdom or the insight to say, let me map out all the cases. And then what they found, if you note there in red, is they noticed that the cases were adjacent to pumping stations, which makes sense because cholera is waterborne. So you can collect data using a variety of methodologies when you're conducting epidemiology. So when you really think about epidemiology, focus on the problem to be solved and take action, because epidemiology is an applied science, and it's an applied science to really help control morbidity and mortality within your particular population. So this brings us to the end of our series, and this series has focused on quantitative decision-making tools, and we've gone through a number of different tools. My hope is that you'll find these tools useful, whether you're a student or whether you're in practice. So please make sure that you share these videos as well, so that way you can educate others about that. Because what my goal is that you use these tools to prevent unnecessary suffering, morbidity, and mortality. Thank you very much. And again, my name is Dr. Marty Martin at DePaul University, Director and Associate Professor in Health Sector Management.